Enter the room.
Hello,
Hello.
I'm one of Dr. GP Surgery. I'm talking to John Bennett.
Yes, sir.
Nice to meet you in the first place. What would you like that I will call you today?
John would be fine, doctor.
Okay, this is completely fine. Okay, could you confirm your age, please?
36 years old.
All right, okay. So, how can I help you today?
Actually, doctor, I was bitten by a cat while I was on holiday in Turkey, and I'm really worried about that. That's why I came here.
I'm really sorry to know about it. And would you like to tell me when it's been happened this?
It happens yesterday.
Yesterday. Okay. And what exactly the cat bite you? Where exactly the cat bite you?
Actually, while I was had a walk in the park, and then wild looking cat bite me.
All right. Okay. So when the cat bite you, what you did after that?
Yeah, actually, I immediately squeezed the wound and wash it thoroughly and went to the hospital. And there they apply some bandage, clean it and apply some bandage and given me painkillers.
I really appreciate that you did some right things. So after that, what precaution they give you?
Sorry.
What precaution they give you?
No, they just apply some bandage and given me the painkillers only.
Okay. So have you opened the bandage at the moment?
Not yet.
Okay. Have you noticed any oozing, any bleeding come out from the bite?
No, no, no.
Okay. Uh, John, I'm just reconfirming again which part the cat is bite you. It is a hand, it is leg. Where exactly the cat bite you?
Yes, so it's in my right hand.
It's just and is the cat bite you in other any other part of the body?
No, no, just the right hand.
Is the right hand. Okay. So after that, have you got any fever?
No,
Okay. Any problem with the breathing?
no.
Nothing like that. Okay. And as when you see the doctor, as they give you any medication for you?
No, doctor, just only the painkillers.
Okay. So let me ask, are you still in the pain at the moment?
Sorry?
Let me ask, are you still in the pain?
No, 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 not in the pain.
Not in the pain. Okay. Uh, apart from this, is this happened on the first time?
Yes.
Okay. So can I ask you about your vaccination history? Are you vaccinated?
For what, doctor?
For any, have got like any vaccine, all the vaccine which we normally we got it, like like everyone person got it there after 10 year we got a vaccine.
Yeah, actually, I don't know
And
when I had my last
it's
tetanus
just-
shot,
okay,
but I do remember getting a shot. Yeah,
okay.
not,
So let have been diagnosed with any medical condition?
no,
Are you taking any medication?
no.
Are you allergic to anything?
Yeah, I'm allergic to penicillin, doctor.
Penicillin. Okay, that's completely fine. Okay, and so uh, so thank you so much for coming today to me. So what I'm going to do, I'm going to check your pulse, blood pressure, temperatures, and I'm looking to the wounds, how the wound exactly look like, and
Okay,
after that, what we need to do further, so we can do for arrange for the management. Okay.
okay, doctor.
Okay, so I can see there's yeah, this is I can see a bit yeah, I can see the wound. Yeah, it's look like a little bit deep and it's red colors and uh yeah, it's more look like as yeah, I can also see the sign of inflammation there. And you told me you experience the pain while I'm just putting the pressure.
Mm.
So thank you so much for coming today. So the information which have been gathered and after discussing with you, as look like it is a animal bite. We call this as animal bites. And
Mm-hmm.
other to manage your condition, uh, what we are going to do? Do you want to know about that?
Yes, doctor, I'm really worried about getting rabies. I have heard about that. That's why I'm really worried.
Okay, absolutely. We will definitely discuss about why you are worried about the rabies. May I know the reason?
Because I heard those sort of wild animal can cause this infection.
Yeah, this is good. This is a very concern. I really appreciate. Basically, normally the people who got the rabies uh, is more probably from the dog bite.
Mm-hmm.
Yeah, so there are very less chances that you can get rabies infection after getting the cat bite. So you don't need to worry about these conditions. But the good things you come here is we can manage your condition in other ways. All right, because I can see there's some sign of infection, inflammation is there.
Okay, doctor, go ahead.
Yeah. So what we are going to do for you, I'm thinking we are give some
2 minutes remaining.
preventive antibiotics like prophylaxis antibiotic in this case. And as you mentioned, you are allergic to penicillin, so we will look for other options like clarithromycin, which is the best option, which I'm thinking. So what will they will do in case if you are prone to the bacterial infection, so it will keep you away from getting bacterial infection during that time. Is that right?
Okay, doctor, yeah.
Yeah. The second thing is what we are going to do. So I can see there's still red mark is there. So what I'm going to do, I will clean this. Okay, and I'll reapply again the bandages. Okay, and I will advise you just changing the dressing regularly. What it will help that your wound will be recovered in less of the time.
Okay,
Is it
doctor.
clear to you?
Yeah, doctor, do I need to get any vaccine for this? Because I don't remember when I was take the last tetanus
Yeah,
dose.
yeah. As you mentioned me, yeah, we are going to definitely discuss about that things about the vaccines. So as you mentioned me, you're not remembering when you got the vaccines. So what I'm planning to do, I'm planning that we can arrange your appointment as well for getting a vaccine, and we will also give you tetanus vaccine at the moment as well.
Okay, doctor.
The planning for the appointment for the vaccine, we can arrange your appointment for getting the bolus vaccines, in which all type of vaccine has been included. In case in futures that you have their own immunity, that you can that your body can fight these like infections. If someone is prone to, if someone is got like this cat from animal bites, is it clear to you?
Yeah, doctor. Yeah, doctor.
Okay. So as you mentioned me, you got a painkiller medication, so it's better to go.
Move on to the next station.
Hi guys, thank you so much. So, absolutely. So, what else can you tell me about this bite, doctor? Like, if you are planning to give antibiotics and tetanus, what is the category to be precise? All right.
Um,
So, when it comes to animal related prophylaxis, you are looking at the level of exposure. So there are three categories where you have category 1, 2, and 3. So this would actually fall into category 3. So category 1 is basically there's no broken skin, it's just a lick or something. Category 2, if there is a broken skin and then there is a lick or even a scratch, or if there causes any break in skin, that is category 2. And category 3 are the ones with bite. All right. So try to mention it that way, because depending upon the category, you're giving the treatment. Right. Another thing that came up is he doesn't know if he's gotten tetanus vaccine. I mean, he knows he got a tetanus vaccine. He doesn't know when. So what do? Do you give a tetanus? You very clearly mentioned that if you have got the tetanus vaccine in the last 10 years, you don't need to get it. But at this point, this person doesn't know if he's got a tetanus vaccine. Then what are you going to do in this case? In less than 10 years booster, but he doesn't know when he got it, Dr. Chakuri. So what are you going to do? That's that's the thought. We give it. Yes, when in doubt, just give it. But yes, in this case, we would give it, because we have to specifically ask if it is less than 5 times that he's gotten those shots. That's why there's a concept of overexposure. But you know, that's what you need to. Another question you need to ask is, how many times do you remember getting it? Right. So if it's just once, it's okay. If this patient might not know when, if it's within the last 10 years, it's better to give it. Right. But he kept asking about post rabies prophylaxis. Will you be giving any rabies prophylaxis in this case? Anybody? Dr. Noor, you have something to say?
No, we'll get it.
Yes, in this case, you will be giving rabies prophylaxis. So a couple of our doctors have also answered on the chat. So why it basically Turkey is supposed to be a high risk area for rabies. In fact, every place in the world is a high risk area unless they are completely developed. So the places where rabies is eradicated from, especially from stray animals. So specifically, you have to look for whether it's domesticated or stray. So since he mentioned it is stray, it is a high risk, right? So the places you don't think of it as high risk is UK, US, Singapore, Japan. You know, think of all the developed countries. Over there, rabies cases are not among stray animals, but if there is a bat bite, yeah, that is again a high risk. So you want to keep that in mind, even with the developed countries. All right. So, so Turkey is actually, since it's stray mentioned, it is basically a high risk. So you have to give rabies prophylaxis. So can we have any idea about? Do you guys know how rabies prophylaxis is given? Like, what do you give in rabies prophylaxis? Anybody? Any? We should give immunoglobulins. Yes, that is a part of immunoglobulins, and also vaccines. I don't know, if you guys have encountered animal bites, but I'm from India, and working in the emergency, we have one or two cases of a dog bite definitely comes up, and these are the most painful people to treat, especially when they are children. Most of the times they are children. So what you usually do is you take around 20 units per kg of the vaccine, the immunoglobulin, sorry, and you have to directly inject it onto the wound. This is the worst procedure in the world. And so you have to directly inject it on the wound as well as around the wound, as they are in pain. On top of that, they're giving you more pain, you're giving them more pain. The parents are also super worried, and they feel you don't know anything, because who would inject an injection onto a wound which is already bleeding? But unfortunately, that is the treatment. Apart from that, whatever is left in the syringe, you give it IM. So one thing I actually realized this, by a process of living and learning, that you can actually give a local anesthetic before you give the injections. I didn't know that at that time, and that case went really badly for me. But that's something that you can do as well. You usually give a local infiltration of lignocaine, and then you can give the vaccine as well. So this is, if you actually do encounter this in your clinical practice, it's one of the most difficult cases to treat because of the procedure that you have to do. So yes, and what about the antibiotic prophylaxis? Yeah, so when rabies prophylaxis comes into play, rabies is given 3 times usually. 4 times, 3 times, yeah, 3 times. So 0, 3, 7, and 21. Sorry, 4 times. And if they're immunocompromised, there is an extra dose that is given in 24. So keep that in mind. So you give it at 0 day for the vaccine, the rabies vaccine. Then you give it at 3, then you give it at 7, then 21, and then 24. 24 or 25, I'm not sure. But let's quickly go through this particular case. So how do you mention it? So, this is a case of cat bite. You mentioned this is a case of cat bite. But why even though if it's a case of cat bite, why would you give the prophylaxis? That's what you need to mention. And because this is a high risk case, you should always inform your senior, because this is a rabies case. If rabies it's an eradicated case in the UK. So you really don't want it to spread. You don't want it to get worse. So you need to inform any of these cases to your seniors if at all encountered, right? So Turkey is considered a high-risk country when it comes to rabies, especially from stray animals. It looks like the cat bite broke the skin, which puts you at a risk of infection and may carry a risk of rabies and tetanus. So that is one way you can actually explain the diagnosis, because, you know, by saying that this is a cat bite, I mean, that's exactly what he came in with. Like, yes, I know it's a cat bite. Give me some more information, right? So this is one way you can actually put that, you know, into your diagnosis. All right, so prophylactically, this patient is, what to say, allergic to penicillin. Good catch. Every time you have to give antibiotics, think about allergy, because most of the times when you have to prescribe antibiotics, always ask the allergy history. So in this case, you mentioned you will be giving a macrolide like erythromycin. Yes, you can give a macrolide, but in this case, you actually give, you know, a tetracycline like a doxycycline, and you give an anaerobic cover, because you saw that it was a deep wound and a bite, be it a human bite, an animal bite, or a deep infection, surgical infections. Those are times when you can have an risk of anaerobic infection. So you always give an anaerobic cover. Does that make sense, guys? So always give an anaerobic cover even with the gram-positive cover that you're already giving. All right. And this is usually, since it's not a confirmed case, there is no fever or any issues. So you give it for 3 days. Otherwise, if it's, you know, if it actually has any systemic manifestations, then you give it for a little longer, probably 5-7 days. Good job on the wound irrigation and, you know, changing the dressing. That's good job. And analgesia for the pain. So this was mainly the thing. And vaccine. Let's look at the vaccine. So tetanus booster, not indicated if the patient has had adequate primary course with the last dose within 10 years, right? If unclear or less than 5 doses, give another booster. All right, because it's unclear. In this case, I actually make sure to make it unclear. But the person does say that, yeah, I got it, but I'm not sure when. Right? So if it's unclear, give the dose. Seek senior opinion about rabies vaccination, as Turkey is a high-risk area, as again, and post-exposure prophylaxis. Day 0, administer the first dose of rabies vaccine, if indicated. Human rabies immunoglobulin. This is that terrible injection that you give into the wound, unfortunately, right? So it is given infiltrated as much as possible around the wound and within the wound as well. I'll just add that in, with the remaining dose given intramuscularly at a separate site from the vaccine. All right. And then the next dose you give it, the second dose is on 3, 7, 21, and 28. I'm sorry, I said 24. I'm extremely sorry for that. 28. All right. And it's usually given if you are immunocompromised. All right. Okay, let's quickly look at the performance. So this is something that I wanted to tell you guys. This is a case that has been coming a lot lately. So think about, you know, when was the last tetanus infection taken? Think about the category of bite in this case, and think about the antibiotic cover that you have to give, because it's an animal bite. It does run the risk of having any anaerobes as well. So, and since it's a deep bite also, so do think about the anaerobic cover. All right. Yes. Oh, this is a good one. So if you have had a previous rabies vaccination, then will you vaccinate this person? You spray the immunoglobulin. I'm aware of the infiltrating, Dr. Chukuri. You actually inject it into the wound. I'm not sure about the spray. I mean, this is the first time I'm actually hearing about the spray, but I'll look into that. I'll actually look into that, and I'll you know, address it as a blog. Does that work, Dr. Chukuri? All right. Okay. So another question that I had was previous rabies vaccination. If this patient had a previous rabies vaccination, will you give him more vaccination? Would you vaccinate him? Do we have anybody answering? Dr. Noor?
Oh, he got rabies vaccine.
Yes, if he's gotten rabies vaccine in the past, would you be vaccinating this patient? No, you will be giving him another vaccine, but then the schedule will be doses. It will be 0, 3, and that's all. You won't give the 21-day dose in these cases. So, but everything is
How long
almost
it work? If someone got it, the rabies vaccine, how long it work?
how long? I'm sorry, how long ago?
Yeah,
I
like when we need to repeat.
I'll check it out definitely. But you do give another vaccine. I'll just look at the duration of how long before. Thank you. That's a very good question. Yeah, I will look into that. Yeah. So yes, so we address that, and that's also a very important question to ask. Has he gotten another rabies vaccine, right? So let's just quickly look at what was covered and what was missed. Any social history, discuss smoking, alcohol, living situation, occupation. Yeah,
For me,
sure.
I don't
I
think
mean,
it's important.
yeah, I don't think it's that important. Even I wouldn't stress because you only have so many questions to ask. But if you can definitely understand, because this is another good question to understand if he has any risk, because you cannot have alcohol with metronidazole. So if you are giving an anaerobic cover with metronidazole, you will have a dull sulfiram-like effect. So you want to rule out that possibility. So that would be a good question to ask if you were giving that antibiotic. But yeah, just keep that in mind if you're giving this one. Do keep that in mind. And occupation is a good question to ask, especially to understand what is the effect he would have with this, because it's on his finger. What if he has to do a typing kind of a job, right? How would you address that? You would give him a little more painkillers, right? If it's a little something stronger. Right. Vaccination history, confirm tetanus and rabies vaccination status, examine vitals, general physical examination, wound examination, and lymph node examination. Lymph nodes are also very important, especially when you're thinking rabies. Yeah. Otherwise, good. You asked a lot of good questions. Confirm name, age, confirm the reason for visit, discuss concerns about the cat bite, ask open questions about the cat bite incidents, including location, depth, and the frequency of bite. It came and bit you multiple times or not. Clarify the context of the cat bite, including when and where it occurred during the trip. You need to understand, establish the timeline. So whenever you're giving these medications, you have to give it immediately as possible. So you need to understand what exactly happened when you got bitten. Were you given the prophylaxis there itself? Were you given immediately? So in this, the timeline that I established was he was bitten yesterday, and today he's come to the emergency. After coming back to the country. So give it immediately, right? Clarify the context of the cat bite, including when, where it occurred during the trip. First aid measures, good job on asking that. That was a very good question. Infection signs, explore local systemic signs of infections like fever, chills, fatigue, general malaise to assess for systemic infections. Medical history, review past medical history, medication, allergy, especially penicillin allergy. Good job on that, because you need to understand if this is an immunocompromised patient. Accordingly, your vaccination routine kind of changes. So, good question. Wound care advice, thorough irrigation, warm water saline, and cover and dressing. Pain management, yes, he is currently not in pain, but you have to keep giving pain management so that he continues not to be in pain. Explain the diagnosis clearly. Cat bite and may infect and may carry a risk of rabies and tetanus, right? Prophylactic antibiotic, prescribe metronidazole and doxycycline for 3 days due to penicillin allergy. Seek senior advice whenever there is a risk of rabies, because this is an eradicated condition in the UK. You definitely want to tell your senior about it, because he is who is responsible for the team. So something as big as suspicion of rabies should not go unnoticed by the senior or the consultant, right? Evaluate tetanus immunization status. If less than 5 doses are unknown or not had a tetanus shot in the last 10 years, give a booster. Rabies vaccination, seek senior advice for rabies post-exposure prophylaxis due to high-risk exposure in Turkey. You want to do these things, So Every time for every management, we tell 3 important things that you should try to incorporate. Even if you don't know the diagnosis, try to do these 3 things. Set a follow-up, because you just gave him a treatment plan. So you want to see if that treatment plan is working. So you want to check with him, over a certain period of time, how his symptoms are, if they've resolved, they've lessened, if the treatment that you have planned for him is working, right? Do safety netting. If you know this is rabies, you need to give some idea that, if you see these signs of rabies, please let us know, avail the, closest medical help as soon as possible if you see these signs, right? And provide educational leaflets. So patients, you need to keep them informed. So even though you've had a good long discussion with these patients about their problems, you need to make sure that they have all that information with them. So it's a good practice to keep them informed by giving a leaflet or a pamphlet regarding that condition or the treatment plan, because NHS has made so many leaflets on different varieties of issues and conditions and help that people can avail. So, use that to your advantage, right? Because you're giving them a credible source to actually, look up. Because otherwise they might just go anywhere in the internet. They might actually fall prey to any hoax that's been going around. So you're actually giving them a credible source that they can search and understand more about their condition. Right, so try to do these 3 things. These are more, that's something that they try to incorporate in every consultation, and that's what they want to see, if you are able to do these things as a regular practice in every consultation. Yeah, acknowledge. Yeah, I think your interpersonal skills was pretty good, but I would never give a 4. So if you're getting marked in the PLAB 2, never expect a 4. It's almost
Basically, I don't know. I got 4.
I'll give you a 3. Most of the times you get 3s, but some very rare occasions you get 4.
I got 4. I got 4 in the plate too. I got 4, 2, 3 times.
Absolutely. Oh, you got 4 times.
Yeah,
Yeah.
last time in my last exam, I got. So I'm not sure why they give me. So
Oh,
I
that's pretty good, especially if you're getting it for interpersonal skills. That's pretty good. So then, Doctor, when is your next exam?
July.
Okay, July. All right.
I
So
am
I guess.
talking to this. I'm asking for this app, but I'm thinking give me discount to.
Uh, yes, we do have a discount, especially since you've actually joined our platform. We have a 40% discount. I'll just ask the examiner to put the coupon code so that you can use the coupon code. It's on any of the, you have plans for 1 month, 2 months, and 4 months. So you can actually try that. We even have a trial plan where you can use it for, 7 days just to see how you like it. Right. So definitely, I'll just ask the examiner to put. Yeah, he's just put the coupon code. You can see on the chart. There's a special 40
I will
coupon.
text you, and your name is on in the group as well, in WhatsApp group.
I am using the same phone as a moderator, the number as the same moderator. So you can just text the moderator. That's good enough, right?
Okay.
You can reach me on that. Yes, absolutely. If you have any issues with any technical issues, please do let us know. We can get on a call and we can address that. Dr. Chukuri, if you would want to get on a call with us with the issues that you're facing, please do message the moderator of the WhatsApp group. We can find out if if there are any technical errors that we can fix from our end. And same thing to Dr. Motahari. If you have been facing any problems with the app, especially logging on or the simulator link, please do let us know. We'll just try to understand why that is happening. We'll get on a call and we can address that. All right. Yes, your interpersonal skills were pretty good, I have to say. And I would still give a 3 because I mean, I also haven't gotten a lot of 4s. I usually get a lot of 3. I got a lot of 3s in my exam. So yeah. So amazing, doctor. That was a very good performance. Just keep an eye out for the management, right? So management always try to give these 3 things. Those are very important. And specific management for this case is a little you need to understand a little bit. So that's why I actually chose this case for today, because this type of case has been coming a lot. So yeah, it
And
was good to
so
it.
if you tell like animal bite, I don't think this was the problem, or we need to tell is a cat bite.
I'm sorry. Should we tell anyone?
The cat,
Are you?
it look like an animal bite. I see in
Um,
some notes because basically I didn't read this case like frequently. So
this,
yeah, so I just see it somewhere before, and it was
that
mentioned this is animal bite. They may diagnose of animal bite, so this why I give animal bite. But from my understanding is a lot. So from my looking, this management is quite easy to understand this case because no one explained this case before, like in this form, which I can see now.
All right. Thank you so much. Yes, absolutely. Because he says that it is an animal bite. That's why we are calling it an animal bite. We already have the history of trauma. So, it's kind of evident. But if it's a human bite also, you have to give an anaerobic cover for that as well. Just want to put it out there. All right, guys, that brings us to the end of our session. Thank you very much for joining. So the weekends we usually don't, take any classes. I will see you guys again on Monday. It will be on the same time. Thank you so much, Dr. Chukuri. I really like those, flurry of emotions. All right, amazing then. So have a nice weekend, everybody, and the rest of the day. I will see you guys on Monday, and good luck with your preparation.